Once again at the University of Toledo Medical Center, we have plastic surgeon Dr. Marlene Welch with us. And we're going to talk about a topic, doctor, that is probably something that not everybody wants to talk about, but breast reconstruction when you have a breast cancer patient just coming off Breast Cancer Awareness Month. When people approach you about it, are people hesitant about it? Do they not understand the process? What is an average patient kind of, what's the direction they come at with you?
Well, a lot of the women who come to our office are at first sort of just in shock about having breast cancer, and then they have to confront the issue of having to have a mastectomy, which is a deeply personal experience for them, and it's not a conversation they typically have. So yeah, I spend a lot of time explaining to women what their different options are and that they actually can have breast reconstruction. Amazingly, about 70% of women who have a mastectomy for breast cancer don't even know that this is something they can do for themselves.
And you were just telling me that statistic, and it's amazing with the technology that we have that people don't understand that, but do you think it's an education from your perspective, at least as being a plastic surgeon, that you need to fill people in that this stuff, not only that it exists, but the technology is evolved, that it can be something done in a timely manner and done efficiently?
Absolutely, and actually recently with the addition of a second plastic surgeon in our division who has most recently been trained in some of these most highly technical reconstructions, we can do breast reconstruction for a woman, and it is much less morbid. They can get out of the hospital a lot more quickly and not have the same kinds of rates of complications that they've had before. So I think that we're doing a very good job recently with breast reconstruction.
Is that a difficult conversation to have with a woman? It's just not only are they wrapping their heads around cancer, but they try to wrap their heads around what is next. Is that a hard talk to have with somebody?
It is, because the different options are either we can use implants, which is a fairly straightforward operation to use implants to reconstruct their breasts, but there are a lot of women who don't want implants. They want to use their own fat from another part of their body, and that's a hard conversation to have because that's a long operation and they're looking at scarring another part of their body to reconstruct their breasts, and that's a big decision. But we are able to do those operations very safely and very confidently. So.
As you've gone through your career in medicine, are you surprised at how the technology has come forward to the point where you're at today, where not only you're working with two people, but the things you can offer to women?
Absolutely. In the past, the major reconstructions that we did using, for example, the abdominal tissue, required us to remove the muscles out of their abdomen and left women with quite a bit of weakness in their abdomen afterwards. But now with some of the newer reconstructions, we don't have to do that anymore. We can actually move the fat from the belly right up to the breast and reconstruct their breasts without taking the muscle out of your belly.
So that's going to be an emotional and a physical thing for people. I mean, you were talking about the physical aspect, but emotionally, I guess that's just kind of another level of how you provide care for people, is making sure that mentally they can wrap their head around what's happening to them.
And it's interesting, too, that a lot of women, even after they've had their breast cancer and they feel like they are survivors of breast cancer, if they don't have a reconstruction, there are still women out there who do not have a breast anymore, and they can never seem to get past the fact that they have breast cancer because they're looking at this all the time. And so it's interesting that breast reconstruction can actually help women sort of overcome their cancer diagnosis by sort of bringing their bodies back.
So this is just one more piece of the healing process that people may not necessarily think about.
Absolutely.
All right, Dr. Marlene Welch, we appreciate your time once again here at the University of Toledo Medical Center, and that is your Talk Back.